All right, let's talk the most complex joint in the body, the shoulder. When we refer to the shoulder, we are referring to the glenohumeral joint, which is where we have this glenoid fossa that comes off this larger scapula bone, and it meets with the humerus, which is our upper arm bone, and it forms a head at the top we call the humeral head. This is what we refer to as a ball and socket joint. So there's a lot of movement at the shoulder. We can circumduct, which makes it inherently unstable because we have all of that motion. But usually you would have dynamic stabilizers, which we'll talk about in that next section with soft tissue. But because of the shape of this glenoid and the amount of motion that we're doing and the type of dynamic stabilizers we have, our shoulder is very unstable and can lead to a lot of injuries. So when we're first talking about the shoulder, we need to orient ourselves to what is happening. So there's actually three joints that make up what we refer to as the shoulder girdle, not just the glenohumeral joint, but the shoulder girdle, which produces all the movement from the shoulder. So there's three joints that have to work together at one time to produce the movement. So the flexion, extension, abduction, horizontal, adduction, abduction, external rotation, internal rotation, all of those motions have to come from the entire shoulder girdle, which consists of glenohumeral joint, the acromioclavicular joint, which is the where we have the spine of the scapula coming to the end, meeting at the acromion process. So the end of this spine of the scapula. So this is the posterior scapula. You have your spine of your scapula that meets at the acromion at the end. Then you have this clavicle bone in the front. This is your collarbone that runs right here. So this is your collarbone or your clavicle, and it meets with your acromion at the AC joint, the acromioclavicular joint. And then you have your scapulothoracic joint. So you have your rib cage here in the front, and your scapula, which is your shoulder blade in the back, sits on the thorax, and it glides. So this can actually, if we're just looking at the body here, and this is the body, the scapula can go up and it can go down. We can pull it in and retract. We can also protract around the rib cage. So when we're doing like punches, the scapula is having to rotate around the rib cage. So it's actually moving, and this movement is really important to how the glenohumeral joint is stabilized and how all of the muscles that act on the shoulder, how they work and operate, because most of them are coming from the scapula, especially the rotator cuff. They're all attaching from the scapula, which I'll talk about in the next section. So really understand what the bony elements of the shoulder is, that you have this big bone, the scapula, that's your shoulder blade, and the back comes out to be a spine that attaches here at the AC joint and attaches to the clavicle. That attachment, the AC joint, attaches this shoulder, this whole scapula and the shoulder bone to the rest of the body. And it has this little, what we call glenoid fossa, which makes the socket part of the ball and socket, but it's very shallow. And because it's shallow, and because you have this oddly shaped humeral head, it makes it very susceptible to injury and to dislocation, which we'll talk about later on. So this is the shoulder. Just understand there are three joints, and the main primary shoulder joint is the glenohumeral joint.